Yeah, we'll give a few minutes for a few more people to join before we start. So welcome everybody as colleagues are continuing to join. And as we wait for one more minute, I kindly request you, as you join, to just put in the chat your name and where you are coming from. Again, welcome to this webinar, which is looking at the current context of climate change and health research and action in Africa. So we are really very happy to have you and to consult with you in this process. Feel free to put in the chat. We just want to know who you are, who is joining the call, who is joining the webinar, where you're coming from. If you feel like put your country and your organization. We'll appreciate that very much. Of course, we'll get more details as time goes. So we'll be able to collect or collate additional details from you. But again, welcome to this webinar convened by the Africa Research and Impact Network and the Africa Population and Health Research Center, APHRC, and a study that we are collaboratively undertaking on transdisciplinary climate change and health research and action in Africa. So this is a study, as you might have read in your registration, that this is work that is being supported by Wellcome Trust. And the idea is to try and find opportunities. What are the safe spaces? What are those strategic niches through which climate change and health can be brought together, or the stakeholders in that space can work together? We know that there's already quite a lot of perspective in that. So we are going to start right away. My name is Johannes Atella. I'm the chair of this session, and I'm the director of the Africa Research and Impact Network. At ARIN, we bring together over 200 researchers from across 36 African countries to do two things. One is to consolidate evidence on best research and impact practices. And number two is to support learning, peer learning, on different innovations that are happening in different contexts, focusing on various areas that are very critical for the growth of African partner states. That is in the context of sustainable development. So again, welcome to this webinar. This webinar is part of a broader study that is looking at transdisciplinary research and action in the area of climate change and health in Africa. And as I've mentioned, it's part of a study that is supported by Wellcome. And it's great that Wellcome is well represented here by Dr. Modi and the team. who are going to give us more details about what vision they have around this study. And as I've mentioned, just as an introduction, we know that, of course, health and climate change are coexisting in the same kind of space and systems within Africa. And of course, there's a lot of work that is already going on in that space. The stakeholders here today are already doing a lot of work in terms of trying to, address the impacts of climate change, but also trying to address health issues. But I think one of the most fundamental things that we deal with today is the fact that these two fields remain isolated in terms of their operation. So while we have a very good sort of community of health researchers and of course policies that have been developed, especially in Africa, and on the other hand, we have very good and kind of well-developed climate change community and policy processes within Africa. These two fields are still operating in isolation. And that is not to say there has not been any efforts towards trying to create linkages. Indeed, there's a lot of efforts and initiatives that are going on in terms of trying to bring these two fields together. Our concern and our sort of gap that we are trying to address in this study is that while there are those initiatives, there are those efforts towards bringing these two fields together, in Africa, this is not well developed, and partly because of a number of challenges that I think we will be looking at throughout the study and of course throughout the webinars that we will be having. As I've said, this is one of our first webinars. We're going to have more webinars that are going to focus on different aspects that tries to bring these two fields together. So again, as I've mentioned, we understand there's a lot going on, and therefore the objective of this particular webinar today is to really take stock really in terms of what is it that is happening in this space. Who is doing what in this space? What are the questions that are being addressed? What are the ongoing research agendas that are being sort of pursued within this same space? And most importantly, what are the gaps? What are those challenges that really are impeding the kind of transdisciplinary research and action in health and climate change that we really envisage to see, given the interconnectedness of these particular fields? So the key thing for us here is really to understand more broadly what's going on. And most importantly, to begin to see what are the opportunities for action in ways that do not kind of replicate the same things that have been happening over the years, but builds on some of those existing opportunities to create a more impactful agenda through a transdisciplinary climate change and health research and action in Africa. Having said that, I want to therefore invite Dr. Modi from Wellcome Trust, who is going to basically give us a much more broader overview of what this initiative that Wellcome is looking into is all about, and what is the vision, what is the expectations that we foresee as we undertake these engagements. Dr. Modi, you're welcome. So Dr. Modi is the head of capacity and field development, climate and health, at the Wellcome Trust. So she is the one who is basically responsible for this study. And therefore, I welcome you, Dr. Modi, to give you a quick opening remarks. Thanks.
Thank you very much, Johannes, and good afternoon, everyone. Thank you so much for your time in joining this webinar today, and to Aaron and APHRC for hosting it. So I'll just give you a little bit of a context to why Wellcome is supporting the study and our particular interest in this area. So basically, we have funded Aaron and APHRC to undertake a study of the climate and health landscape in Africa. And this study aims to identify how researchers and policy actors, whether they're from government or civil society advocates, community representatives, journalists, or even the media, how these different communities of researchers and policy actors can be supported to address the region's growing climate and health challenges. We also we're going to be using the findings from the study to inform our investments in the climate and health ecosystem in Africa to really help to catalyze it. And I'll say a bit more about that in a moment or two. And as part of the study, we also want to ensure that we can identify how our investments can help enhance implementation of existing climate and health policies that are already in the continent. On health and the environment, or the African Union strategy on climate, for example, which also has references to health. So today, this first webinar, as Janice has said, is going to focus on really mapping and understanding what is happening in the research and health, climate and health ecosystem, as a way of us understanding and then working out what can we do next to really help further catalyze more research and action. So why climate change? The impacts of the climate crisis on health in Africa are very real. Some examples of how climate and health challenges are already being experienced today are increased cholera outbreaks, for instance, in Malawi, Mozambique, Kenya, which are increasingly occurring due to cyclones and floods that are becoming more common and extreme as a result of climate change. And these outbreaks will particularly affect vulnerable groups who lack access to clean water and sanitation. And they're also increasing pest outbreaks. For instance, there was a desert outbreak of locusts in the Horn of Africa, which was due to new and extreme climate-induced weather patterns. And that led to poor crop yields and has exacerbated food and nutrition insecurity in the region. Another example is increased risk of zoonoses, as land such as and natural habitats such as forests are either cleared for agriculture and intensifying agriculture production, or even by people who are just cutting down trees for firewood because they don't have access to basic fuel. And this destruction of natural habitats is resulting in livestock increasingly and people increasingly coming in contact with wild animals, increasing the risk of transmission of new diseases from wild animals into people, and with devastating effects on human health. But there is hope. A few weeks ago at the African Climate Summit, several heads of state of Africa committed to supporting African-owned, African-led solutions to climate change to drive new financing to Africa because there is a powerhouse of potential on the continent to address the climate challenge. And we were really delighted to see that the summit's declaration recognized the health implications of climate change and the related impacts that this is having on lives, livelihoods, and growth. Obviously, there is much more that could be done, but at least there was that acknowledgement that the climate challenge is also a health challenge. So who is Wellcome and why are we here today? So for those who are not familiar with Wellcome, we're a science funder. Our aim is to put health at the heart of climate action. And we have a relatively new climate and health strategy, which has 4 goals. First is to generate evidence on what is the growing burden of climate change that is affecting health what is the growing burden of health that is linked to climate change in today and into the future in different parts of the world, including in the African continent. The second goal is really understanding what are the effective interventions that people can help people adapt to climate change in ways that protect their health. A goal around what are the effective mitigation solutions which can help reduce greenhouse gas emissions, slow down the pace of climate change, and also have health co-benefits at the same time. So for instance, designing transport systems in ways that reduce pollution, but then also potentially can promote increased physical activity. And then the fourth goal is really how we can build the field, how we can grow the field of researchers who are able to generate evidence on the solutions, their costs, which ones are most effective, for example, but then also support the broader research, the broader ecosystem of actors who are needed to help create an environment within which that evidence can be taken up and acted on by decision makers, whether they're in government or the private sector. And so those are the advocates, the civil society organizations, the other actors who can use their evidence. And so this particular area of study is informing our investments in our capacity and field building program, which I'm heading. And in this particular program of work, we really want to see how we can help to further catalyze the climate and health field in Africa. And as I said before, this means focusing not just on researchers, but the other ecosystem of actors. We want our investments in future to respond to African-led priorities, and we really want them to help catalyze climate and health action quickly. So we're not just interested in research that leads to publications, we're interested in research that can lead to action in the next 5 years. So we're looking at currently scoping a significant investment that will move from funding beyond short-term projects to supporting an investment over the longer term. And so some of the questions we'll be scoping over the next few months are, what's a kind of good length of period to really provide funding that is sustained and gives people that space to really develop capabilities, capacity, programs, solutions, which can really help drive evidence-based action. And we also want to avoid funding in silos. So we're very keen to hear your ideas on how we can support this ambition collaboratively, for example, through science policy centres that foster collaborations that are locally led. So this is the first of 4 webinars that ARIN and APHRC are hosting. Each is focusing on a different theme. We also, a few weeks ago, during the week of the African Climate Summit, hosted a kickoff consultation event, and with a number of partners. Some of you will have attended that. And some of the key takeaways that I heard at that first kickoff event that we were hosting were that there is an existing climate and health field in Africa, although it's pretty small at the moment and focused on a narrow set of topics, for instance, malaria. But also the climate and health evidence and actions needs to center around people. That will enable a whole systems approach, because people experience everything together. They experience the climate impacts on their health, how it impacts their livelihoods, how it impacts their habitable environments. And for those who have livestock, even how it influences their livestock. Some of them are losing livestock because of climate-induced challenges, and that is a source of livelihoods for them, as well as potentially food. I also heard that we need to ensure that the approach to climate and health doesn't just focus on the 2 sectors of climate and health, or the environment and health, but it really needs to be broadened out to cover the intersects across all the other relevant sectors in society, whether those who are dealing with livelihoods, land use, the design of flooding systems, housing. All those different sectors need to be engaged in supporting the climate change and health landscape and solutions. So I'm really looking forward to hearing the conversations at today's webinar. Thank you so much for coming and being so generous with your time. And yeah, I'm looking forward to hearing how it goes, and hopefully hearing from you again in future webinars as we continue to design the consultation, hear from you, and design our investments. Thank you very much, everyone. Back to you, Johannes.
Thank you so much, Modi, for setting the scene. Indeed, funding is very important, but we need to know what needs to be funded. You mentioned a key point around Africa-led priorities, and I think that's very fundamental, that these priorities be defined by the stakeholders in this call today, and the ones that would be joining other consultative processes. At this juncture, I just want to quickly engage as I bring us to the next session, which is on the keynote address from some of our great experts in the fields. I would like to ask the participants just to respond to a quick Mentimeter question. There is a Mentimeter link that has been posted on the chat. So if you click on it, you are going to find a question that asks you to state some of the 2 important priorities that could enable health and climate change stakeholders to work together in the research and of course in the policy space. Just click on the link, the Mentimeter. I don't think it needs a as we see what your thoughts are in this particular space. What are the things that really could enable a much more strategic and coherent and impactful integrated working together between climate change and health in the research and policy, and of course in the action space. So we are seeing some responses coming in and talking about capacity building, collaboration networks, finance, and collaboration. Collaboration seems to be already taking a lead, sustainable livelihoods, data, there is funds. So collaborations and funding, seem to be coming up quite a lot. And progressive policies has come in. Financing, of course, this is a very important part, and this is part of the conversation that we are having today, and why Wellcome is also quite passionate about these discussions and consultation. So keep them coming as we move, keep them coming. I see more capacity, evidence, and knowledge that demonstrates areas of possible collaboration. That's very critical, because really collaborations have to be anchored on particular needs, as we've agreed that we need Africa-led priorities to really shape this process. Yeah, so thank you. Keep them coming. We will get them together. I give maybe half a minute again for those who have not fully responded to finalize their comments and send. Good. There's political goodwill, very important. Yes, you can always do many things, but without the political goodwill, it becomes very difficult to implement them. So that's very critical. Thank you so much. Harmonization of climate change and health data. These are of course, some are coming up in the chat. So the IT team, please keep an eye on those ones so that we can capture everything. Every voice matters in this process. So it's very critical. I'm therefore going to thank you so much for the responses. Very useful, very, it shows us the direct into the next session, which is the keynote addresses that we want to hear from some of the node experts working in this space at various decision-making levels, but also various research spaces. So our first keynote speaker, and before I introduce this, maybe just to highlight that we're going to have the keynote speeches. Then after that, we will go into breakout groups where we will really have a lot of opportunities to be able to give more details and contribute more to the discussion. So don't feel left out. There's still a lot of opportunity to be able to engage. So let me welcome our first keynote address, who is Dr. Adelaide Onyango. So Dr. Onyango is the Director of Universal Health Coverage at the World Health Organization. She's got really a vast and excellent and relevant experience. I'm not going to read all of this, but you can see it for yourself. A number of have interacted with Dr. Onyango in one way or the other in different places. I used to hear her voices in certain contexts, but it has through these processes. So I welcome Dr. Onyango to give your keynote address on the subject matter.
Thank you very much, Johannes. It's a pleasure and an honor to be here today. I need to share my screen because I have a presentation. So if I could get those rights, I'd be very glad. In the meantime, I'll just be saying that I was invited to speak about the context of the climate and health continental landscape. Somebody's mic open. And needs of African countries, how WHO is responding to those needs, or rather working with the countries in responding to those needs, and how the study of the transdisciplinary research and action could help that action. So let me see if I can share my screen. Let's go this way. share.
The IT team, could you enable Dr. Nyango to share her screen?
I think it's coming. I think it's coming.
Okay.
Can you see it?
Yes, you can see.
Okay, great. So I might go into presentation mode. Try and get that into presentation mode. Are we good?
Yes, we are good.
Okay, great. So thank you very much. Now, looking at this space, we can start from where we know, and I think Modi has already mentioned some of these challenges that of more than 2,000 public health events that were recorded between 2001 and 2021, 56% were climate related, and that we are actually witnessing an increase in climate-linked emergencies, so that between 2011 and 2020, there was 25% more climate-related events compared to the previous decade. Then, in terms of the human impact of this, 5.3 million people displaced by climate-related disasters in 2020 alone, and that projections suggest that this could go up to 15 million per year by 2030. We are also seeing estimates that show that climate change will cause over 250,000 deaths by 2030. That's per year. And this is due to climate-related issues, malnutrition, malaria, diarrheal diseases, heat stress, and among others. That it could lead to a 48% increase in population at risk of malaria transmission alone. That is not counting other diseases. That agricultural productivity is expected to decrease by up to 50% in some countries, and that by 2030, African economies will be losing between 1.5 and 3% of their GDP per year due to climate-related issues. And this is going to be in impacts in different sectors. So when we look at, oh, something has disappeared from here. It's a pity. Okay, there it goes. Okay, so we have documents, policy documents that are very familiar. We have already heard Modi cite the Libreville Declaration, which talks very broadly about health and the environment, but in fact includes actions in other sectors that need to be undertaken for us to address those challenges. Linked with that, we developed an updated, after one that was interrupted by COVID-19, we have an environmental determinants of human health strategy, the management of these for the African region, that was adopted by the regional committee of the health ministers in 2022, and it's going to be covering 2022 to 2032. But the specific actions that are addressing public health adaptation to climate change are contained in a resolution that is still the current document on that was adopted in 2011. And so what the priorities in this strategy include the vulnerability and adaptation assessments, health national adaptation plans that come as a result of what those assessments reveal. Then we work on supporting capacity building so that we mainstream climate resilience in health programming, improve early warning and surveillance to climate sensitive diseases, promoting partnerships, intersectoral collaboration, and advocacy so that we can access global multilateral financial mechanisms. We've made very little progress in this, especially from the health angle, because as you will see, there are certain things that we have not yet, there are some capacities that we need to build for this. And of course, community engagement, because as is said very frequently, the emergencies begin, outbreaks begin in villages and affect people, affect real human beings. So we need to have that awareness raising that's taking place, social mobilization, because we must have communities engaged, and we must also come up with programs that are implementable at community level. When we look then at what we have done with the countries related to those areas of intervention, We have a number of countries that have conducted vulnerability and adaptation assessments, as well as developing health national adaptation plans. As you recall from those are the strategic priorities that have been identified. And in this, we have the countries that are in green have both vulnerability and adaptation assessments, as well as then developing health national adaptation plans. While the ones that are in yellow have only conducted vulnerability assessments, and the ones in orange have done health national adaptation plans, even without doing vulnerability and adaptation assessments. Then when we move over to the right, we can see a map that tells us which countries have then gone to healthy national determined contributions. And the language of healthy, or rather nationally determined contributions, was for me a new language when I came into this space working on climate change and health, because I was thinking, what kind of language is that? What, health nationally determined contributions, what does that mean? So I began to try and understand that, because if we're going to have a conversation in this space, I need to understand the jargon. And we have come to the conclusion, looking at, thankfully, there is a scorecard that is published by the Climate and Health Alliance that tells us which countries are in their nationally determined contributions. I still struggle with those words, to which one comes before the other one. In any case, this is a space that seems to be a very critical entry point for the health sector into climate, in terms of climate negotiations and any global damage feature by including health indicators in the nationally determined contributions. Now, when you go into this, and I think this is where I want to spend some time with you as researchers, looking at what is in this. If this is the ticket that's going to get us into climate negotiations, what does it involve? What are we saying? What is it saying? So I was very fascinated looking at the scorecard and celebrating that the top 3 countries here are actually from our region: Burundi, Cote d'Ivoire, the Democratic Republic of Congo. But then when you look at what those indicators are, we have in the lightest shade of green here, integrated governance. Then we have health impacts. Then we have health sector actions. Then we have health co-benefits, economics and finance, monitoring and implementation. So when you look at that range of indicators, do they mean the same thing if they appear or not appear in an NDC that is going to be the bargaining instrument for the inclusion of health in climate change considerations? It's a question that I'm asking with expectation to be instructed, because it is an area that is new. And I think it's new for many people that are working in the health space, because if we are going to be part of those negotiations, as we're trying to be, we need to understand this language. But perhaps what we need to do is to deconstruct the jargon, so that as we venture into the research space, we can begin to define these things in ways that will enable us to use them consistently in a standardized way, and to speak a language that can be translated into the actions that are needed for us to move the agenda forward on addressing the health impacts of climate change. So very quickly running on to, we don't have time to pause over there for an interactive, it would have been very useful. But moving on to then what WHO is doing. So the 3 levels of WHO, we're working together on coming up with, there's a strategy on climate change and health. And so what are we looking we put this into the action areas into three. These three areas are on addressing the wide of health impacts of climate change, which means diseases that are linked to that, but also agriculturally connected impacts on health, questions of heat stress, migration, and all that, insofar as they touch on human health and well-being. Then we're looking at strengthening climate resilience and environmental sustainability in the health systems and health facilities. And finally, on promoting health co-benefits of climate change through the mitigation actions that we can undertake. And all this, as you see, is centered on climate resilient health, meaning we're putting the human health at the heart of this. But I think, in fact, we're also talking about animal health, because if there is drought, it's those animals that are impacted. And, you know, the whole environment is actually impacted by this, and there's that destabilization. I'm sorry, there's somebody drilling in one of the floors, and I hope it's not all coming to you. Now, the actions that have been taken, one of the key milestones in the journey of health into the climate change space was the COP26 Health Initiative that was launched in Glasgow, where the objective is building climate resilient, sustainable, low carbon health systems. And added to this, we have had countries committing to implement, to that commitment. And I'm proud, very proud to say that out of the 65 that have signed up, 25 of them are from the African region, meaning that there's a lot of interest in getting into that action, climate action, and health. Linked with that is the Alliance for Transformative Action on Climate and Health, which is a technical mechanism that supports the countries that sign up to the initiative on so that they are enabled to implement their commitments. And of course, Wellcome Trust is a very key partner in these processes. The that Alliance for Transformative Action focuses on with regard to the first commitment of the climate resilient health system on supporting the vulnerability and adaptation assessments, then moving on to the adaptation, national adaptation plans, and then using those to start negotiating for some funding to support instruments that exist. As I said, we have made very little progress on this. To date, I can safely cite just one country that, with WHO's collaboration, managed to get less than $500,000 for the GCF readiness program. So there's a lot that still needs to be done for us to tag on to that. And of course, if the future of that depends on our making health visible in a consistent and very standardized way in the nationally determined contributions, then the work that I was trying to explain previously, which I hope you understood as researchers, is going to be very, very important. And then, of course, in terms of the sustainable low carbon systems, working on commitments that countries are helped to make in terms of moving towards net zero emissions, if they can make those commitments and then work towards them, doing assessment of greenhouse gas emissions, and developing roadmaps to achieve their low carbon reduction targets. We have a few resources that have been developed to support that. So you can see on the right here, the vulnerability and adaptation assessment that is available. And we also have an operational framework for building climate resilient health systems. So countries can look at to see in that construction, this is now the infrastructure. How do we set up a climate resilient health facilities? And then how do we work on climate change through adaptation planning? And this involves very much interactions also with the communities. I think this should be sufficient, even if I did not answer all those questions.
Thank you so much.
Yeah, back to you then, Johannes. Thank you.
Thank you, Dr. Onyang. very fundamental, bringing out the element of polycentricity in this interaction around climate change and health. And I think that is what we are looking at, so that we don't create isolated experts of health working in climate change, and also we don't create isolated experts in climate change working in health, but creating really a true, safe, and mutually integrated sort of interaction and transdisciplinary teams that could support research policy in the two fields, very integrated and transformative way. Thank you so much, and we will really request that you share with us your slides. They're very informative. Healthy NDCs, I think that's a critical, point of discussion. Can follow up, but allow me to bring the next speaker. Who's going to just give us a bit from the change a wing of things. That's Ms. Natasha Museba, who is a member of the adaptation team, the Africa Group of Negotiators. For those who are not conversant with Africa Group of Negotiators, this is the team that actually present our at the international climate change discussions through the UNFCCC, a legitimate team that is critical on policy issues and also feeding back to the African member states. So Natasha, the floor is yours. You have 10 minutes. If you can make it less, we'll appreciate, because I think you already flags with regards to time.
Well, thank you very much, Ernest, and I will try my very best to keep it short. Thank you for this opportunity. It's an honor to be here and to speak as part of the Africa Group of Negotiators. I must say that Dr. Adelaide actually sounds very much like a negotiator already. And so I'm glad that she set a tone for us. Also, thank you for the welcome remarks. You highlighted some of the key factors. So like you mentioned, the Africa Group of Negotiators is the technical team of experts that speaks on behalf of the African region under the United Nations Framework Convention on Climate Change. So the climate change process is governed through the UNFCCC, and because the process is party-driven, there are what we call regional blocks or regional negotiating groups, and Africa has fortunately set up itself as an Africa Group of Negotiators, which is one of the biggest negotiating blocks in the UNFCCC process. There are other groups such as the least developed countries who we work closely with. Our main mandate is to frame common positions of negotiation on behalf of the continent in relation to all factors around climate change. So mitigation, adaptation, loss and damage, many others that you might hear about along the way. So our main role is to bring country and regional interests onto the table within the UNFCCC so that decisions can be made on aspects that concern obviously the world, but more so are specific to the African region insofar as climate change discussions go. And so that is why we come in. And today, the reason that I gave this keynote address is because within the Africa Group of Negotiators, we have a group that is called the Adaptation Team. And this team is specifically focused on negotiating adaptation matters. However, the segment on health is cross-cutting, as we have heard from other members. We discuss health on the negotiating tables, also in relation to agriculture, land use, mitigation, loss and damage, as well as in financing. Discussions on health do arise. However, the team currently leading the research and development of a concept note around creating the linkages on health and climate is within the adaptation team. So far, what have we done? Health has been spoken about, like was mentioned, almost as far back as 2011, but also the Libreville Declaration set out a good tone on health and environment. And only recently has the limelight grown around paying more attention to how we can link the two and ensure that we avoid the silos that already exist, because we cannot separate risks to the environment from the risk that exists to public health or human health. And so what have we developed so far? Some of the data that we have gathered so far is that we note that there is 85% of global air pollution, which is coming from fossil fuels and biomass, and that over 7 million people are dying each year from air pollution. The second issue that we have taken the time to explore is the fact that the Intergovernmental Panel on Climate Change report, which is the assessment report number 6, highlights that Africa in particular is at the front line of climate-induced health burden. It was noted in the report that there has been a 63% increase in the number of zootonic outbreaks in Africa in the decade from 2012 to 2022. And compared to the year 2001 to 2011, zootonic diseases actually represent approximately 32% of Africa's infectious disease outbreaks, which were reported from 2001 to 2022. So there has been a drastic increase. Now, this increase has been associated to many reasons, and in particular, it's the fact that Africa is one of the fastest growing populations in the world. And with that, there is a growing demand for food derived from animals. There is rising urbanization and encroachment on the habitats of wildlife. And so that is the core on which we have based our intersection on health and climate. Now, the topic on health and climate within the AGN explores the intersection between climate change and health, emphasizing the importance of climate-resilient health systems, adaptation strategies, and integration of climate considerations into public health policies, and also the integration of health into national climate policies. So there is a regional approach as well as a national approach, as was mentioned by the previous keynote speaker, Dr. Adley. The national adaptation plans have a certain focus on health so that we can broaden our discussions around how do we create climate resilient health systems and adaptive capacity for climate in order to, of course, avert the risks that it has on health. Now, there is also an increased research that has been going on, and something we have developed within our concept note is emanating from the Stockholm 50+ Environmental Summit, where world leaders had noted that there are increasing hazards of climate change posing mental health challenges. And some of these have included anxiety, sadness, suicidal behavior, and substance abuse. Now, with all of these challenges that we found, something that our research has revealed is that climate financing remains low insofar as it relates to health, because reports have indicated that climate finance targeting the health sector to date is less than 0.5% of multilateral climate adaptation funding, which is extremely, extremely low. And so as the Africa Group of Negotiators, we are calling for adaptable, flexible, rapid financing mechanisms which can address quick onset and fragile human mobility related health issues. We are calling for resilient infrastructure and technologies for health to include improved housing and to limit exposure to climate hazards. And we are also calling for investment in air quality monitoring systems and improved water quality, sanitation, and hygiene structure. It is hoped that there will be improved water, sanitation, and hygiene approaches, such as promotion of diverse water sources of water supply and improvement in health infrastructure. I'm happy to report also that African stakeholders gathered in August in Lilongwe, Malawi, to discuss the nexus between health and climate change, and in recognition of the United Nations General Assembly human right to clean and healthy environment. So at this meeting, the One Health approach was considered, and there was a focus on the interconnectedness of human, animal, and environmental health, because it is seen as pivotal in addressing climate-driven health challenges. I am also happy to report that at the next coming COP28, there is a dedicated day called the Health Day, which the COP28 presidency has endorsed and is holding at ministerial level, which is something that is extremely progressive as far as this discussion goes, because once you introduce a topic at ministerial level, it finds its way well within the system at high policy level and can filter down even to technical level and up to negotiations. It will be a side event, but it's a good start because it will develop a report that will frame language and data for us to take on into the overall climate negotiations. So some key principles that we consider: to promote ecosystem health, improve healthcare access, and enhance infrastructure to tackle climate-triggered health issues, adopt a holistic approach to health, incorporating the One Health and PHED approaches, to prioritize just transitions, emphasizing decentralized clean energy for healthcare delivery, and to advocate for developed countries to enhance mitigation actions with clear emission cut targets. And finally, that we must boost African leadership in health response strategies to climate and health. So as the AGN, we will take this process holistically. We are glad that we can have platforms like this to talk around research, because we are gathering the data now, and we hope to frame some key, precise, and consistent messages that will form the negotiation points. Because when it comes to negotiations, we need to be as precise as we can, because there's so many interests taken into account. And so when we have clear messages based on statistics, numbers, with justification, in the next 2 to 3 years, the story will be different, and we will have a center climate and health action nexus, which is considered in the system. So thank you for your attention. Thank you for your time. I will end there for now. Thank you, Joanne.
Thank you so much, Natasha. Very fundamental. You brought in a very key issue around financing, health issues within the climate change funding spectrum, and that this is significantly low. That's a point of discussion. And of course, asking questions around, what constitutes the scope of health within the climate action. Some of your points around the coming engagements should be very useful at the COP, and we will keep on this discussion to see how can we sort of move together towards the COP, frame some of those ideas, but make them framed in a much more impactful way, not just because we want to take them into the policy space, but because they're really based on what Modi said, Africa-led priorities, and they're going to be impactful if investments are deployed in them. I want to bring my final keynote speaker, Professor, let me just share so you can see. All right. So we have Professor Cromwell, who is actually the Vice Chair of the IPCC Working Group 2. You are aware that IPCC is a fundamental part of science and research when it comes to climate change. And of course, health is becoming very fundamental in that particular process. So Prof, you have 10 minutes. Oh, yes, if you make it less, we'll be very grateful. Go on.
All right, thank you, Johannes. Perhaps you could remove your slide so that I could be able to see a few things from where I am, because yes, you are talking about time being of essence. And being the last speaker, I think I enjoy the privilege of having many things attached here and there, and mine is perhaps just to flip through a few issues, in most cases trying to reinforce certain elements within the narrative that has already been made. Otherwise, it's in my great pleasure as I do acknowledge the invitation to speak to you, colleagues online, by the conveners of this webinar, comprising the ARIN, the Wellcome Trust, and the Africa Population and Health Research Center. Yes, in this round of very important and timely knowledge and information exchange, on matters climate change and health in the context of the African continent. The choice of the overarching theme here becomes very, very important to us in the sense that it is looking at elements of integration of climate change and health research and the requisite actions in terms of mitigation, I believe, and adaptation in the context of Africa. This, I should say, is indeed timely, and it does align very well with the current concerns by the global community as echoed by the UN constituted bodies, including WHO, the World Meteorological Organization, and the United Nations Framework Convention on Climate Change. Why I say this is because we already have had in the Climate Week held in September this year during the UN General Assembly in New York, the COP28, United Arab Presidency underscored the urgency of choosing health as a priority area for the upcoming COP28, which is slated somewhere 30th November to 12th December in the United Arab Emirates. And as I agree with Natasha, yes, there is a day that's dedicated to health issues. And in this, I would like to say we see an opportunity for us to lift the political profile of the climate health nexus, as well as an opportunity for mainstreaming health issues into the global climate change agenda. As we have already been told, yes, health issues have been tackled here and there in our NDCs and other climate communications, but not to that level of magnitude that warrants the attention, looking at the protracted impact of climate change on the sector. I would like to further, of course, laud the decision by the organizers of this webinar series for choosing to start with this critical underpinning topic on enhancing transdisciplinary research and action in health and climate change in Africa, with focus on current state of integrated climate and health initiatives in the continent. This topic, I must say, it provides us with a window for all the acts in the health and climate change domains, including policymakers, climate and health professionals, academia and research, civil society organizations, youth and entrepreneurs, to identify or rather recognize the goals in co-designing, co-development, and the co-delivery of solutions to climate-related health in a changing climate. What we realize here is a strong emphasis on the core aspects of designing, developing, and delivering of solutions to climate-related health challenges, noting that the health challenges, of course, go beyond the health sector issues, goes to agriculture in the context of the malnutrition-related health issues, and name them. It goes to the water, also in terms of the water quality issues. It goes to the environment in terms of environmental quality, and so forth. So what we see today, as earlier shared by colleagues, is the fact that climate crisis currently being experienced is, of course, unequivocally a health crisis that requires urgent intervention, noting that climate change poses an imminent and severe threat to human health. It's already adversely affecting nearly half of the world's population this day as we speak. It's therefore more urgent now than ever before to elaborate the nexus between climate and health, as adverse climate change impacts continue to ravage national as well as the human systems. As you are aware, health is closely related to climate variability and change, including their extremes. We are so much carried about the change and very little about the variability. And that is, in fact, a mode which we must also embrace dearly, because it's the first line determinant of the climate threats to our health systems. We know very well that the warmer average temperatures will lead to hotter days, as well as more frequent and longer heat waves, which could lead to an increase in heat-related challenges, including deaths. And as such, we know that exposure to extreme heat, it can lead to heat stroke and dehydration, as well as cardiovascular, respiratory, and cerebrovascular diseases. We also see that the shifts in the climate affect the quality of air we breathe, both indoors and outdoors, leading to asthmatic attacks and other respiratory and cardiovascular health effects. Warmer temperatures can increase the frequency of days with unhealthy levels of ground level ozone, which is indeed a harmful air pollutant and a component in the smog. Increases in the frequency of extremes of weather events, including precipitation, flooding, droughts, and storms, do threaten the health of people during and after the event, reducing the availability of safe food as well as drinking water, damaging transport infrastructure, interrupting communication, utility and healthcare services, as well as creating and worsening mental health impacts like depression and post-traumatic kind of stress disorders. We also observe that the changes in temperature, precipitation, and extreme events will also increase the geographic range of diseases, as earlier mentioned, which are spread by vectors, including mosquitoes, ticks, as well as fleas. The climate change increases the risk of water-related illnesses through increasing temperature. We see also more frequent heavy rains and runoff, and the effects thereof of storms on water quality. As it is, we also can observe that climate and the direct impacts of higher concentration of carbon dioxide in the atmosphere could also have an adverse impact on food safety as well as nutrition. And as we go on, we also will see that changes in temperature and precipitation, as well as droughts and floods, also affect agricultural productivity in some regions, which may compromise food security and threaten human health through malnutrition, spread of infectious diseases, and food poisoning. So we see the health sector here not just being directly impacted, but it's also being impacted through secondary pathways. The cascading nature of the climate risk from initial impact level transmits through sectors other than health to finally land at the health sector table. In other words, we need to be up to the task when it comes to undertaking our climate actions. Because as we have already seen, climate change is indeed presenting as the biggest threat to health in the 21st century, putting every survival of humanity at stake. And therefore, we should not suffer from the impacts of poor and expedient choices which continue to harm the earth and its population. But we must invest in human well-being through resilient health systems that guarantee adaptation to the escalating burdens of disease and the impacts of extreme weather, including heat, that are killing humanity a day. And in that regard, we see, therefore, a case where the spread of the climate-sensitive diseases, for example, will depend on both climate and non-climate factors, such as land use, as I mentioned, socioeconomic and cultural conditions, pest control, access to healthcare, and human responses to disease risks. What is the solutions to these challenges, therefore, go beyond the health sector? They require inclusive as well as diverse and or transdisciplinary approaches to research and action in developing and delivering solutions to climate change related health problems. The achievement of this goal requires specialized capacities in terms of knowledge product generation, monitoring and surveillance of climate and health conditions, data sharing and archival, early warning systems, and as it were, because of the multidisciplinary actors, the need for a coordination mechanism to onboard a multidisciplinary team of experts as well as expert institutions drawn, of course, from climate, health, and allied science, in academia and research, practitioners also in public and private sector, the NGOs and the CSOs. Furthermore, this will also require some legal and policy frameworks that address climate change and health to operationalize the partnerships and collaborations among the multi-stakeholder actors. So where these instruments exist, alignment of sectoral policies and plans will need to be done to harmonize them in order to avoid overlaps, a duplicated effort and costs, disparity in reporting, and also be able to leverage the existing institutional and human resource capacities while addressing, of course, climate change-related challenges in the health sector. So increased investment in adaptation and resilience solutions as envisioned by the COP28 agenda, aiming to advance more equitable solutions, especially in countries that emit the least GHGs, greenhouse gases, but are most adversely impacted by climate-driven health outcomes, then becomes critical.
Thank you so much, Prof.
Yes, that's fine. I'm just concluding.
Excellent.
I'm
excellent.
just concluding.
Thank you.
Yes. Concluding. Yes. We then see the fact here that we have opportunities to reorganize ourselves as a continent to see how best we then play an active role in the COP28 process under the coordination of the African group of negotiators, expert support, and the overall AGN. So a radical vision then for transformation and substantial investment in the health sector to construct resilient, equitable health systems capable of withstanding the impacts of climate change is then urgent. And therefore, as we even undertake our routine development, we must foster a balance between environmental, social, and behavioral health and preventive care alongside acute treatment needs to be prioritized. And finally, we need a paradigm shift where a perception shift of health in Africa from a cost to an investment with economic returns could trigger a more concerted effort towards resilient health services in the continent. So thank you very much, Johannes. Thank you very much, colleagues. We may share the other information later on. Thank you so much.
Thank you. Thank you so much, Prof. Exactly why we are having this conversation, that the linkage between climate change and health, whether it's in terms of the impacts of climate change and health on health, is really very complex. And that's what you brought out quite clearly. And so we need to make very strategic choices that are not just cherry picking interventions, but they are truly transdisciplinary to be able to confront this complexity. So thank you for taking us through that stock take in the process. So we want to move to the last part of the webinar, which is on the breakout sessions. We are going to try and get more thoughts from the audience. I know our time is really calling, but at least we have a few minutes, 10 to 15 minutes to get some thoughts from different members of the group today. So please, I can see people are already choosing their places or the groups that they are joining. But let me welcome my colleague, also Kanyiva, to perhaps steer this into the next step. Kanyiva, are you there? Kanyiva is from Africa Population Research Center, HRC. So welcome, Dr. Kanyiva.
Yes, thank you, Johannes. Probably you could guide us on the duration of the sessions before I introduce them.
Maybe we could have about 10 minutes, 10 to 15 minutes.
10 minutes. Okay, so we shall be going into our breakout rooms of split into 3 areas: research, policy, and practice or action. So based on what we've chosen in that untitled poll that popped up, then we shall be directed to those rooms, and then we can reconvene after that to discuss a little bit more before we close the webinar. Thank you.
Thank you, Dr. Kanyiva. Let's choose our groups, and IT team, please help to move people to their respective breakout room. So we have about 38 already taken the poll to their respective rooms. A number, about 30 or so, have not selected. Please select your room so that we can direct you there. So Brian and team, please take charge of the process now as we move people to the different breakout rooms.
Hi, can somebody help me? Oh, thanks. Hello.
Yes.
Sorry, I need to be changed. I went into the wrong room.
All right. Your name is?
Violet. I need to be placed in the policy group. Thank you.
Violet Murunga.
Yes,
All
please.
right. There you go. Huh?
Yeah. I can see Sammy. Sammy, I know you've been doing some work around this as well. Do you want to say something on that? Sammy Jamar. Or Judith, any thoughts on that? Judith Namanya.
Thank you so much. I joined late, but I had something that different that I've been thinking about.
Yes, please. Just air it. Yes.
I work on climate and health, and normally when we talk about climate and health, I was thinking about
awareness is a common theme there. That of local evidence research. Perhaps another 30 seconds, and then we can open the next phase of this conversation in this group.
Please paste the question.
Okay, let me paste the question in the chat. Just 1 minute. What are the practical challenges faced by communities in responding to climate-related health impacts? I've pasted it in the chat again.
Okay, good. Welcome back. It was quite a short breakout session, but I hope technology has enabled us to capture as much as we can. And of course, because this conversation is still continuing, and we'll have more opportunities to drill deep into some of the issues that are emerging. I want to invite the group moderators to just give us very quick 1 to 2 minutes update on what are the key points that have come out from their groups. And allow me to kindly request the participants to give us just 10 more minutes. We started a bit late, just 10 minutes so that we can conclude the session in a much more sort of conclusive way. So the first group on research, Dr. Kanyiva, you are moderating this. You want to give some quick highlight of that? As Dr. Kanyiva gets ready, then I see policy. What are the issues? Charles?
Thank you, Johannes.
Kanyiva is here. Go ahead.
Yeah, I'll just I'll highlight the gaps that have come through, which are like 3 critical ones: capacity for people to carry out the research. The second is focus on NCDs and SRH and climate as part of the climate discussion, climate change discussion. Then action on research to policy, so that policy decision makers are brought to the table with clear evidence and that they can understand, instead of we talk too much about climate and everybody is talking about climate, and the policy makers will probably just make policies without a strong basis for whatever it is they are deciding on. So how do we move research to policy so that there's evidence that can be actioned? Thank you.
Thank you, Dr. Kanyiva. And policy now that you've been mentioned, Charles and Nicholas. Oh, sharing. Okay.
Thank you very much, Johannes. Quickly, these are some of the key ones that were identified by our members. I think I would begin with the bottom one that was spoken to earlier, the Libreville Declaration 2008, which is really the primary document for us in terms of referencing climate and health as a common challenge as a development issue. And then the members from Kenya spoke specifically to what's happening in Kenya, being led by NCPD, the National Council for Population and Development, and that's around the PHE, the Population Health and Environment Coordination Working Groups, as a structure that is advancing PHE as a combined issue. And then there's also a strategy on PHE. And so mentioned that in East Africa, there's a specific working group as well for PHE, in addition to a standing working group on disaster, on pandemic preparedness, which incorporate One Health approach to response to pandemics. And then the Africa Climate Change Strategy 2020 to 2030 as a key document that speaks to the nexus between climate change and health. The members also raised concern that this is a new area for them. They really haven't had exposure, and really they welcome this discourse to enable them get exposure to this conversation. Thank you. Charles will speak to the next question, which was on the challenges or gaps in developing integrated policies on climate change and health. Welcome, Charles.
Yeah, thank you, Etienne. One of the key major challenge or the gap that is really expressed is the inadequate awareness, especially among the duty bearers or the decision makers, and especially on the linkages between climate change and health and the benefits of integrating both. And I think some shared in the charts, and the question here is, do the office bearers who often come in to office for a short term based on political cycles really have the time to first even get to know what's happening and also get the details from the technical people, but also especially at the policy space, how do they approach it? And the agency now to incorporate, and I think it was one of the key discussions also at the Africa Climate Summit. The second one is the working in silos, which are at the program level, at the departments, at the sector level. And of course, this one has been a key kind of characteristic of the development space, where there are specializations and then again, temptations to work in silos in terms of delivering also their targets, but now creating both physical and non-physical barriers when it comes to integrations. And then also one of the key gap also is the lack of incentives to work across policy silos. So I think these are some of the gaps that we really need to look at unpacking them, especially whether these types of nature of incentives that are really lacking in this policy space when it comes to integrating both the climate and health policies. And then also the question around local evidence, especially in research. And lastly is collaboration between researchers, policymakers, and health practitioners. I think, of course, also touching on the silo approach. Yeah, thank you. We'll, of course, in the report capture some from the chats.
Great, looking forward to the comprehensive report. So practice or action, Melvin.
Thank you so much. I also share my screen, but I have our moderator, the other moderator, Leah, who will also talk about the second question. So our question was, in what ways are the stakeholders, sorry, just a moment. Okay, our question was, in what ways are the stakeholders working together to address the health impacts of climate change? And what came out strongly was collaboration and partnership, because we've seen that in recent past, people have been working in silos. And at the moment, people are trying to foster collaboration. So there is need for partnership so that it can enable us to strengthen the activities on climate change and health. And this will enable us also to bring on board different disciplines and people from different organizations and with different backgrounds to complement all the ideas and approaches to tackle climate change and health. And our other moderator, Leah, will take us through the next question on what are the practical challenges faced by communities in responding to climate-related health impacts. Thank you.
Okay, thanks. If I could just share my screen real quick.
Okay, let me just stop.
All right, so in terms of practical challenges faced by communities, some of the ones that were highlighted were limited access to finance in addressing climate change impacts. I think this is health impacts on climate change. And then also addressing misinformation was a critical point, while also promoting effective communication, challenges around collaboration, inadequate resources, funding, coordination, and political will, and that is from the policymakers. Data also emanated from our discussion, and inadequate technical capacity in the areas of climate change and health, limited capacity again when you discuss about communities, the lack of ability to translate some of the evidence into policies, inadequate awareness, as well as challenges emanating from, again, funding and lack of skilled personnel. So those are just some of the ones that were highlighted. Thanks.
Thank you, Leah. That brings us to a very important end to the discussion. Indeed, there are quite a lot of points and highlights that have emerged, and we are going to consolidate this to be able to really create or develop a report that speaks to some of the issues or most of the issues that have been raised through this webinar. We close the webinar because I think we are far much off the mark with regards to time. Just to reflect, to just highlight a few things that have come out clearly. One is that climate change and health linkage is quite complex and requires really some strategic understanding in terms of the research needs, what are the evidence needs that really can help to unlock that intersectionality. And of course, there's the issue of, evidence and the question around whether, the topics or the evidence needs are already well communicated or well understood by the different stakeholders, the researchers that are working in the space. So that's an area that needs some more discussion in terms of really, are we aware of the evidence needs, or we, are already, we've already exhausted these particular needs, or there are gaps that needs to be taken into account. The question around research into policy and the enablers for that is very critical, because then building on the evidence that come out of the research that happens, so that's been undertaken, the need to ensure that this evidence-informed policies is very critical. And of course, the big question around capacity, which has been raised, and this is very fundamental, because then capacity, in this case, there has been questions that have been raised in terms of, is it that we don't know the needs, so what needs to be done, or is it that we don't have the capacity to be able to really address or confront those particular needs? So those are questions that we are going to continue addressing in our subsequent discussions. And just to highlight that this is, was one of the first webinar series, which basically was trying to look at the context more broadly. In the next webinar series, we have a number of webinars lined up, which are tackling specific issues. So in the next one, we'll be looking at capacity. That's next month, and we will send this communication to you. We hope you'll be able to join. So we'll be looking at the capacity needs for integrated climate change and health research and action in Africa. And then on the 24th of November, we'll have another webinar, which basically will be focusing on issues around barriers. What are specific barriers that we need to address? We will conclude with a webinar on the 23rd of February, where we'll be looking at what are some of the models that can be supported. These are more of solution-oriented recommendations that we would want to get from stakeholders like yourself, because then the interest in this study is to provide those recommendations in ways that then can direct much more impactful and strategic investments in the area of climate change and health. And finally, as we close, I would like to really request you, there is a form that has been posted on the chat. I would like to kindly request you to look at it and kindly fill it for us. It's more of a short survey, trying to look at some of these issues much more deeply. So it takes about 5 to 10 minutes. So kindly help us in filling that. And of course, just to highlight that we aim to finish this study by the month of March next year. And once we do that, we are going to convene a continental webinar or sort of workshop that will help to validate some of the findings, but also to help in terms of developing some of those recommendations that can be actionable, that Wellcome Trust can take into account in terms of their funding decisions. So this is very fundamental that as a stakeholder group, we continue to engage with this process, so that really the ultimate recommendations are going to be really led by the African priorities, and are going to create some impact when investments are made in that particular sense. I want to stop here and just say a big thank you to all of you. I know we've gone over time. I can see 47 of us still here. So that's a great commitment. And as I mentioned again, we are going to continue with this conversation. It's just the beginning. Today, we've explored a wide range of things. We are going to begin focusing much more into specific issues that are important and that are emerging as very critical to this particular process. So feel free and, kindly help us when we reach out to you for even bilateral interviews and discussions. We'll really appreciate your support in this particular process. On behalf of the Africa Research Impact Network, the Africa Population and Research Center, and Wellcome Trust, we want to say a big thank you for taking your time to participate in this particular webinar. We look forward to having you in the next series of discussions that have been lined up. Thank you so much, and have a brilliant morning, afternoon, or evening from wherever you are. I don't know if there's any other announcement from the team. Otherwise, I guess that's all. Thank you so much, and look forward to seeing you again in the next webinars in the future discussions. Thanks.
Okay, bye-bye.
Bye. Thank you, asante. Asante sana, kila mtu. Thank you so much. Merci beaucoup, everybody. We appreciate you. Good.
Bye. It was a great discussion. Bye.
Thank you. Thank you so much. Thank you, Abigail. Thank you, everybody. Violet, great to see you again. Thank you so much. And everyone else.